For 14 years, from 1989 to 2003, Liberia was engulfed in a violent civil war. The long years of bitter adversity left the country in disarray. Lofa County in the northwest of Liberia was one of the hardest hit areas. Most of its people fled. By 2003, Lofa County had very little infrastructure remaining. Roads, schools, and health facilities had been destroyed. 5 years later, not all health centers are operational. Those that remain are understaffed and often inaccessible. With the war over, people have returned to Lofa County, but they still face severe hardships. Women remain particularly vulnerable to the post-conflict problems confronting all Liberians. Access to basic reproductive health care is a struggle. Kebe Koli returned to her village 2 years ago after many years of exile. Kebe and her family then endured another 3 years of internal displacement, moving from village to village and hiding in the forests. She lost all that she owned. The mood amongst the people is optimistic, but the community's lack of resources is often deadly. Liberia's maternal and infant mortality rates are among the highest in the world. There are still very few health professionals in Liberia to treat patients or educate new students.
At the moment, the country has so many needs in pertaining to the reduction of maternal mortality rate. And since we don't have the skilled personnel in the country, enough skilled personnel, so you have to train those ones that are present. To train a skilled midwife, it will take you 2 years to 3 years for them to be qualified. So in the process, what are you going to do? The deliveries have to continue.
The Liberian Ministry of Health and the International Committee of the Red Cross, ICRC, in partnership, are addressing the shortage of skilled midwives through a program designed to work within local traditions. For centuries, traditional birth attendants have cared for pregnant women in the villages. A program designed to give the traditional birth attendants better skills offers a temporary solution to the chronic shortage of trained medical personnel.
The traditional midwives are chosen in the community by the community themselves. And why the community has to choose them? Because they are taken like volunteers. And the community knows who are volunteers and who are respected. Because, you know, traditional midwives also play a vital role in the community. They do a lot of sensitization, they do a lot of mobilization, and they also take some decisions in the community. So they are very important people, and that's why it's good for the community itself to choose the people.
Kebe was selected by her village to follow the 6-month training program. Completion of the course gives the whole community a reason to celebrate. A special ceremony is organized in honor of the graduates. Kebe started assisting births 60 years ago. Like most traditional midwives, she initially acquired her skills by watching others.
So now I get my willis now, Monte Deja. Can you bobagi? Nang lang nene goke. Ni mania geke. Galang it yours one back. Gaya no lisi la to teno aga kuru no. Kubo for sikano maga, kano gamavu. Tina pe the case. Yati wena a jacket a la boboa. Good pillow wega, got pretty galaveda. You met his ever flew away to solo. Good night was there where I go where you were.
There are many advantages in using traditional birth attendants to provide some basic care in a country destroyed by war. These women usually know the expectant mothers personally. Their practices follow local customs and beliefs. Even when the village women have access to modern health care, they also seek out traditional birth attendants for advice and complementary support. Kebe and her classmate Sunny Lombe are both from Lofa County. They walked several hours to and from every one of the training sessions. Neither has had any formal education. Most of the women in the program are illiterate.
Good morning, everybody. You know, in our body we have salt, we have sugar.
More deliveries take place in the villages. Only a few deliveries that will be recorded at the clinic. We thought that if we train these people, what they are doing will be better because they are already doing the work. So we just need to improve their skills so that they can do even better. And they have proved to be that way. So we are very proud of them. What we target, the first important thing is a clean, safe delivery. Then we also teach them on identifying problems. Because once they identify the problem and refer promptly, then something good can be there for the woman.
After training, the traditional birth attendants are able to follow a normal pregnancy. They're also taught to recognize potential problems early on and refer the women to a health facility. Obstructed labor may lead to the death of mother and child. The traditional birth attendants seek help for women with delivery complications and other life-threatening conditions. During the graduation ceremony, dramas performed for the community reinforce lessons learned. Women wanting to be trained should be at least 30 years of age, already a mother, and must commit to the course for 6 months. They have to pass a test before graduation and afterwards attend refresher courses. They assist in antenatal consultation at the health facility in their area, supervised by the officer in charge. The ICRC initially conducted the courses, but now it also trains members of the Ministry of Health so that they can teach the traditional midwives.
There's one training now that we decided, okay, as a way of supporting and not substituting, we are trying to support them so that they will be able to do it when ICRC pulls out. And they are taking the lead.
In this training course, the ICRC is already providing only logistical support. Soon, the Ministry of Health will be able to run all the courses.
What we are doing now, with the help of our partners, ICRC has done tremendously well. They are giving us support in training our people so that we'll be able to help our women in the communities with delivery and antenatal and everything pertaining to labor and delivery. We use songs and dramas to teach them because they are not literate, they cannot read and write. So if we teach them in song and drama, they remember when they are at home. Any problem they see, they will think about the song and what the song means, and they will be able to handle it or know what to do by referring the case.
So once they are trained traditional midwife, after following the course, supported by the ICRC or any other organization, they go back to their community and they are received back by their own communities, and they support them in their work.
Each graduate is given a delivery bucket stocked with all she needs to achieve clean deliveries. The women regularly return to the health facilities for advice and to replenish the supplies of birthing materials. This also allows for the vital exchange of information about the health situation in their villages.
The tools she is given is not meant for her alone, it's meant for the entire community. And the training also tells her that when she goes back, she has to work with those who are available because she cannot be alone. She has to have some assistance.
The role of the traditional birth attendant goes far beyond following a normal pregnancy and delivery. She also gives postnatal care to the mother and her newborn and key information to the community on nutrition, vaccination, malaria prophylaxis, family planning, and hygiene.
Nama kaya de boy masibete ga pli disease la ga lana amugo ga pago abo ga pago.
Mary is from the same village as Sunny. The nearest health facility is located more than 2 hours away on foot. Mary's 2-month-old son was delivered with Sunny's help.
Take any Sunny glabe, I take care of it. A carvegana. Several leve, take the colazo ugly, Mezara. Take any bova, take care of it, Zive, take a govama tezu. A car got Sunny Lange. Tene toda bebe trigas de Mezara. Or to that bebezo or caso trigas e colazo. But Nika or Gafa. Probably couldn't run soon. Toba Lebra, I was in a good tree. It's a god lives a god tree, plima. Oh, Marvin Faga Nizugliaga, Kama Grandma, a car. Litinalia Tega, Ziagovani, Canazunaleasu. Ya mavingi usukana binale yasu. Bisa bleni ti village jiskela nuglama yeta nuflogo tona meka nuflogo ma. Na mari gitite yana. Le hen globini titlaza tefia numata tulo yima akohoni jadria na tana ti na tale yasu. Na mari gile yana. Tia mavingi usubagi kana mtite yana kezavri mana tipe mari giva veza. Ezu ma vu feva soni aga nuvluga nuno peza ale ya ma ni aza soni boga mave
Gasalizi dowezu, kagalia dowezu. Gajana mavunya katazo ya gakula vama unua tuli na please. Kago kwa bave.
So far, the International Committee of the Red Cross with the Liberian Health Ministry has trained 270 traditional birth attendants in Liberia. These women offer a basic service to communities who have no practical access to qualified medical staff. This training strategy is the first step in a long-term plan to restore an appropriate medical system in a country devastated by years of violence.
They are working for your own people, for your own women, for your own children. So when we have the community, we have the county health team, we are able to build a nation and we'll have a healthy nation.
The time of the training is over, so these women are now ready for certification. Sonny Loban. Gaba Kwale Jonathan.
Getiana no waza. Toga tera now. Gaja go blow up there. Oh.